If you're tired of spending your nights and weekends answering patient messages for free, the solution is not to quit your job. It's this. Hi, I'm Dr. Michelle Chestovich, and welcome to Stress RX. Today, we're going to talk about how inboxes are stealing our evenings and 3 simple steps to stop it today. Number 1, you need to stop the inbox whack-a-mole. What do I mean by this? If you're anything like me, you see your patients, you start to finish some notes, and then you jump around in the inbox. I wonder if there's some patient messages that need to be answered. This is very inefficient, and it is absolutely not sustainable. To jump from one thing to another doesn't give you a clear time and space to think and get the job done. And we often don't do as great of work. And by the way, when are you getting your notes done if you're always jumping to the different messages? So step number 1, stop the whack-a-mole and create a time during your day. Now I get it. Wouldn't it be great if we were given 30-minute spots here and there to actually do our messages? Some organizations do. And if that's you, kudos to you. Keep it up. Many of us have to find the time, but I advise you to speak with your team, your MA, your nurse, and say, hey, I'm going to be checking messages mid-morning and mid-afternoon. And if something more urgent comes up, please let me know, because I'm not going to be otherwise checking the messages. I'm going to be seeing my patients and getting my notes done. What I will tell you is that your brain may become very alarmed because it's used to checking all of the time. You think that you're really good at multitasking. You're not, my friends. You are not good at multitasking. Set a time and stick to it. When you're constantly checking throughout the day, you're not getting it done more efficiently. You're not getting the most onerous task of getting your notes done. And you are actually making it a lot harder for yourself, and work just piles up and you have more to do later in the day. So pick a time and stick with it. I will remind you, because of course we in healthcare think, oh my gosh, but what if something very emergent comes through? There are not emergencies in your inbox. If there are emergencies in your inbox, that is a problem that the organization needs to deal with. If a patient is having an emergency, they will dial 911. If for some reason they inadvertently call the clinic, they will be routed to a triage nurse. Inbox management is not for emergencies. So you just need to calm yourself down and know that you will get to it at the set time. And oh, by the way, it doesn't even necessarily need to be dealt with that day, right? People think, oh, I have to get to inbox 0 before the end of the day. That's great if you have time and energy for that. But if someone is sending a message, most portals will tell the patient, we'll be getting back to you within 1 to 2 to 3 business days. Again, not emergent. Set a time. Stop the whack-a-mole. The second thing that I advise you do is set some boundaries. Patients, of course, love an easy way to get in touch with you. I totally get it. And yet, having our messages turn into a free clinic is not sustainable. And in fact, it's really not the best care for our patients. Most things that patients want to talk about deserve back and forth, deserve an evaluation, deserve answering questions, as well as giving things to look for if things aren't getting better. That's really hard to do in a message. And so I highly advise you create a dot phrase that says, this sounds really important. Please come in and we can further discuss in an appointment. This can often bring up many things for people because people freak out. Physicians I've worked with freak out like, oh my gosh, but I'm booking out weeks or maybe even months. And what I will remind you is that the broken healthcare system does not need to be shouldered on our backs. Of course, we want to take great care of the patients, but doing this care for free at night in the inbox is not how we're going to solve the problem. So set some boundaries with your patients and know that if something is more important, that they too can either get in and see another partner or go to an urgent care or something like that. So it's not an emergency. Use that dot phrase. And the final thing that I would like you to do, the third thing, is get your staff involved to help you today. I would love for you, if not today, in the next couple of days, set aside 10 minutes to speak with your staff that you work with and say, hey, I'm trying to do this thing so that we can get back to the patients more readily and efficiently. And I need some help with that because I am seeing patients. And so these are the typical things that I invite you to just make an appointment for the patient or answer their questions. Teach them how to help you. Now I get it. Staff is busy too, but why is it landing on the physician or other providers' plates to be doing at night for free? I think that's not okay, and it's not great patient care. So let's get our teams involved and say, you can call the patient to set up an appointment, answer their questions. If it's really complex, of course, just call and invite them in. And if you don't have availability on your schedule, they will get them in with somebody as they see appropriate. So get your team involved. We don't need to be doing this at night. Certainly, it behooves the organization that we docs want to take really good care of our patients, and we want to make sure all the needs get met. And yet, when we have a full schedule of patients throughout the day, when are we really supposed to be doing this? It's not easy, and yet it is possible. And it really starts with setting a time, setting some boundaries, and getting your team involved. So I would love for you to go give this a try and report back and let me know what works, what didn't work, and we can tweak things. And this is just the tip of the iceberg of what you need to do in order to get your nights and weekends back. I have been a physician coach for the last 5 years, and I've helped hundreds of docs get back time during their week. You do not need to be working at night. You do not need to be working on the weekends, but you need to learn some strategies in different areas to help get the work done more efficiently. And to that end, I am hosting a free masterclass, How to Get Your Notes Done Faster, on Monday, April 13th at 7 p.m. Central. There is a link in the show notes. Please click to register and invite your friends, because summer is coming. There are way more fun things to be doing than charting, answering your messages, that sort of thing in the evening. So come to my free masterclass and you will walk away with even more strategies that you can put into place and start to gain back time. All right, my friends, that is what I have for you. And until next week, peace and love to all of you.